Hello everyone, today we're talking about a serious health issue. It's one that can hide in plain sight. I'm talking about syphilis. This is an infection that many people have heard of. But do you really understand what it is? Syphilis is a bacterial infection. It's caused by a tiny germ called Treponema pallidum. This germ can cause big problems if it's not found and treated. We need to bring this topic into the light. Understanding is the first step to protecting yourself and those you care about deeply. Syphilis isn't a new disease, not at all. It has been around for centuries, affecting people across the globe. Thankfully, today we have ways to detect it accurately. We also have effective treatments, which is great news for everyone. However, the challenge remains that syphilis can be incredibly sneaky. Our goal today is to unmask this infection completely. One of the most troubling things about syphilis is its profound silence. It can enter your body without you feeling a single thing, no alarm bells. This isn't like a common cold where you start sneezing or coughing quickly. Syphilis often begins its work quietly, completely under the radar of your awareness. You might feel perfectly fine for weeks, months, or even for many years. This is a key reason why it spreads so effectively through populations. People who are infected but don't know it can unknowingly transmit it to their partners. It's a chain reaction that we urgently need to break. Understanding this silent spread is crucial for your personal protection. How can an infection be so quiet, so stealthy in its approach? Syphilis has different stages, each with its own characteristics. The very first stage, known as primary syphilis, might involve a sore. This sore is called a chancre. But here's the tricky part. This sore is usually painless. It might also be hidden inside your body where you cannot see it. If you don't see it or feel it, you simply won't know it's there. Let's talk more about those early clues of syphilis, the initial whispers. The primary stage usually begins with that single sore, the chancre we mentioned. This typically appears about 3 weeks after you're exposed to the bacteria, but it can show up anywhere from 10 to 90 days later, a wide window. The chancre is often firm, round, and, as I emphasized, painless. It appears right where the bacteria entered your body during contact. This could be on the genitals, the anus, or even in the mouth or on the lips. Because it doesn't hurt, it's incredibly easy to overlook, especially if it's small or in a hidden spot. The location of this first sore can also make it very easy to miss. If it's inside the vagina or rectum, you likely won't see it or be aware of it. Even if it's on the external genitals, it might be mistaken for an ingrown hair. Or perhaps it could look like a small pimple or a minor, insignificant irritation. People might not think much of it at all, dismissing it quickly. Now let's be very clear and direct about how syphilis spreads from one person to another. This is absolutely vital information for effective prevention and for protecting yourself. Syphilis is primarily transmitted through direct contact with a syphilis sore, the chancre. These sores, as we've discussed in detail, occur mainly in the primary and secondary stages of the infection. This contact usually happens during sexual activity. This includes vaginal sex, anal sex, or oral sex. If your skin or mucous membranes, like those in the mouth or genitals, touch an infected person's sore, you can get syphilis. It's a very direct route of transmission that requires close contact. You need to be fully aware of this specific risk. It's important to understand that the Treponema pallidum bacteria are highly concentrated in these sores. So, any friction or direct contact that allows the bacteria to pass from the sore to your body can lead to infection. This means that even if full penetration doesn't occur during sex, transmission is still possible. For example, close skin-to-skin contact with an active sore during intimate moments or foreplay can be enough. This is why condoms, while very helpful in reducing risk, may not offer complete protection every time. If the sore is located in an area not covered by a condom, such as the scrotum or inner thighs, transmission can still unfortunately happen. Section 5. The Deceptive Calm, Why Syphilis is a Master of Disguise. Syphilis has rightfully earned its historical reputation as the great imitator or the master of disguise. This is because its wide array of symptoms can look like so many other diseases and conditions. We've seen how the early chancre can be painless and easily missed or dismissed. We've also seen how secondary stage symptoms like rashes, fever, and body aches are very non-specific. They can mimic common ailments such as the flu, allergic reactions, psoriasis, or other skin conditions. This chameleon-like quality makes it incredibly difficult for individuals to self-diagnose accurately. It also makes it challenging for doctors if syphilis isn't specifically considered and tested for during an examination. The truly deceptive part of syphilis, however, often comes with the latent stage of the infection. After the symptoms of secondary syphilis disappear, even without treatment, the infection enters this hidden phase. During early latency, which is within the first year after infection, you might still be infectious to others. But in late latency, which can last for many years or even decades, you often have no outward symptoms at all. You feel fine, you look fine. There's absolutely nothing to suggest that a serious infection is brewing inside your body. Section 6. The price of silence: long-term dangers of untreated syphilis. If syphilis is left untreated, allowed to fester silently in the body, it can eventually progress to its most severe stage. This is known as tertiary syphilis, or sometimes late syphilis. This destructive stage can occur 10 to 30 years after the initial infection was acquired. Sometimes it can take even longer to manifest with clear, serious problems. During this extended time, the disease can cause devastating and often permanent damage. It can affect many different organ systems throughout your body, from your brain to your heart. The consequences can be life-altering, debilitating, and in some tragic cases fatal. This is why early detection and prompt treatment are so incredibly critical. We want to avoid this stage entirely. One of the most serious and feared complications of late-stage syphilis is neurosyphilis. This is the term used when the infection directly affects the brain and the entire nervous system, including the spinal cord. Neurosyphilis can lead to a wide and frightening range of neurological and psychiatric problems. These include severe persistent headaches, muscle weakness, and significant problems with coordination and movement. It can cause dementia, leading to memory loss, confusion, and changes in personality. Section 7. Shining a light. How doctors diagnose this stealthy infection. So, how do we find this stealthy infection if it hides so well and mimics other conditions? The good news, and it's very good news, is that diagnosing syphilis is actually straightforward with the right medical tests. If you have a suspicious sore or a rash, your doctor can take a sample. This sample can be taken directly from the chancre, the primary sore, or from a skin rash lesion. They will then look at this sample under a special type of microscope. This technique is called dark field microscopy. It can identify the distinctive spiral-shaped syphilis bacteria right away if they are present in the lesion. This test is most useful in the early stages of infection when sores are present. The most common way to diagnose syphilis, especially in the later or latent stages when there are no sores, is through blood tests. There are several different types of blood tests that can reliably detect syphilis infection. These tests look for antibodies in your bloodstream. Antibodies are special proteins that your body's immune system produces to fight off specific infections. If you have syphilis, your body will make specific antibodies against the Treponema pallidum bacteria. These blood tests are generally very accurate and widely available. They can detect syphilis even if you have absolutely no symptoms at all. Section 8. Taking control: effective treatments and the power of regular checkups. Here's some really good news about syphilis. When caught early, syphilis is easy to cure. The most effective treatment is penicillin. Penicillin kills the syphilis bacteria and stops the infection. For early-stage syphilis, one injection is often enough. One shot can stop this dangerous infection. Early diagnosis is crucial. It makes treatment simple and successful. For late-stage syphilis, more doses are needed. Typically, 3 injections over 3 weeks. Other antibiotics can be used if allergic to penicillin. Your doctor will determine the best treatment plan. Effective treatments exist. Don't let syphilis go untreated. Section 9. Your health, your power. Staying aware and preventing syphilis. We've covered a lot about syphilis, this silent menace that can affect anyone. We've learned what it is, how it's caused, and how it hides in the body. We've discussed its transmission and serious long-term effects if untreated. Accurate diagnosis is possible through testing, and effective treatment is available. Awareness is your greatest weapon. Understanding syphilis and how to protect yourself is paramount. Your health is in your hands. Prevention is always better than cure. Avoid sexual contact or be in a long-term monogamous relationship. Use latex condoms correctly every time you have sex. Condoms can significantly reduce your risk of getting syphilis. Remember, they only protect the area of skin they cover.